Hello and welcome to Cambridge Clinical. This video will discuss a general strategy to apply to all the situational judgment questions. Now, in future videos, we'll go through the specific question types and how to tackle them individually. But first of all, it's important that you understand an overarching approach to this section, as it really is quite unique compared to the other UCAT sections. So for all SJT questions, I think there are three golden rules. First of all, every question will be dealing either directly or indirectly with one or more of the four pillars or other ethical issues. If you can establish what that ethical issue is, you'll be in a much better position to answer the questions. For example, if you're being asked how appropriate certain responses are to a scenario or how important certain considerations are in making a decision, knowing what ethical pillar you're trying to address will make answering those questions so much easier. If you don't immediately see this, ask yourself what has gone wrong. Has there been a crisis of confidentiality, or is there a great risk of harm being done? This should help to identify which ethical issue is being talked about. The second golden rule in this overarching approach is to rank the ethical problems in your scenario. The passages in this section can be really quite long, and there might be multiple ethical issues going on, so you should rank them in terms of importance. Once again, your most appropriate or important or relevant answers will address the most serious ethical issues, or perhaps they'll address multiple ethical issues. As a final golden rule, you should always eliminate options. In the appropriateness and importance questions, you'll always have 4 answer options. In the ranking style questions, you'll have 3 answer options. If you can whittle these 3 or 4 down to something more like 2, there's a much higher probability of choosing the correct one. Now, we'll discuss more when we go through the specific question types how to whittle those options down. But just remember, it's really, really important to do so to maximize your score. So, as I said, sometimes the ethical issues you'll be discussing are not obvious. It won't sort of say things like beneficence, capacity, non-maleficence in the question. It'll be veiled in a story. So here are a few common scenarios that we'll go through which tend to recur and have similar ethical themes every time they come up. So often, the passages and scenarios will involve medical students. Typically, what they're assessing here is balancing competence with usefulness. Remember, as a medical student, you want to promote beneficence by helping whenever you can and being useful however you can. However, you must also remember that due to your limited competence, you have a real risk of being maleficent as well. Therefore, these questions might assess your judgment of whether or not you should act in a certain scenario. Always remember that you have limited competence, but also a duty to help. Next, there are a lot of questions that deal with patients' involvement in their own care. So these questions tend to focus on the 3 things written in the slide, so patients' autonomy, capacity, and right to confidentiality. The easiest one to spot tends to be references in the passage to patient capacity. So remember, if a patient is unconscious, suffers from things like advanced dementia, or are very young, they may not have full capacity to make decisions. But also remember, if a patient does have capacity, their autonomy, which is one of the 4 ethical pillars, is always of the utmost importance and must always be respected. Finally, often when discussing patients' involvement in their own care, there are references to confidentiality breaches, and these are always also of extreme importance. Therefore, responses that discuss autonomy, capacity, and confidentiality tend to be very, very strong in such scenarios. Another very common theme to come up in the SJT questions is the patient's right to refuse treatment. Remember that if a patient has capacity, they may refuse any treatment you offer. The other important thing to remember that many actually forget is that if a patient has refused the recommended treatment, it's still your duty to treat them as best you possibly can with alternative methods. Therefore, be on the lookout for answers that might involve coercing a patient into something they don't want, and also be on the lookout for answers which involve helping a patient even though they've refused treatment. The final common scenario I want to discuss is that of professionalism. So very often, you're presented with another medical student or a doctor acting in an unprofessional way, and you then have to deal with that somehow. Your duty in all of these scenarios is to make sure that the professionalism is upheld. Often, you'll be presented with scary consequences, so perhaps the consultant that's acting unprofessionally is famously mean, or the student that's acting unprofessionally is your best friend. Always ignore these. If patient safety is not directly compromised, it tends to be better to use a soft approach, so that might be talking to the person, asking them why they'd behaved in that way. However, if patient safety is compromised, the strongest way is always to report the behaviour. So those are a few very general scenarios that often come up. For more specific advice on this section of the exam, watch our next videos on the specific question types.